We're at the TiEcon Day 2 and plenty of excitement here. All kinds of leaders are coming here, different sectors, but trying to talk about that one thing around how AI can make lives better and humanity can still persist. I have with me TiEcon's president, Anita, and Warner Thomas, who's CEO of Sutter Health. Thank you so much for joining us both. Anita, I'll start with, thank you so much. I wanted to start off with you first. The gamut of people that we're seeing at the TiE conference and the startup that is there, there is a lot of motivation around what AI has been thought about versus what AI actually is, and the theme around bridging the stories and AI's aspect in making humanity better overall. Your thoughts?
Yes, and it's interesting, there's a common thread that went through the conversations even this morning. Yesterday's conversation was about cultural capital. Today, Satya talked about that. And then Warner talked about the cultural and social capital and the empathy capital and how they have reduced. Congratulations, Warner, for reducing your physician turnover, because we always focus on patients, but physicians are one of the key fundamental pillars. And the fact that you're making their life easier is huge. And so I think that, this is playing such a big role. And I think the fear of losing jobs, I think you addressed it beautifully, that, it's a while and that you really want to partner with innovators and not just have 100,000 apps that patients have to deal with. So these are exactly the kind of insights that TiEcon looks to bring, and TiE is looking to bring thought leaders like Warner to the stage to make sure that we've got the healthcare, the right story, the right motivation for the investors and the entrepreneurs.
Love that. And we talked about that super app that you're talking about. People do not have the time to look into 100 different things. There is only that much of consumption one can do, and the kind of time that we end up mindlessly, scrolling over the phone and stuff like that. And this is the time it becomes very important as a leader to have a very specific understanding of what healthcare needs. You also have a new chief AI officer coming in for this purpose?
Yeah, we've continued to hire more and more capabilities into our organization. Chief Digital Officer Laura Wilth is driving a lot of this. I mentioned, Sutter Sync is a new technology for us to connect with patients. We're in the final stages of hiring a new Chief AI Officer that's going to help us with these initiatives. But, I think that, going to your point, Anita, how we make it easier for our physicians and clinicians, because I think what technology's done over the last decade is, frankly, made it a little bit difficult for physicians and clinicians. How we can take that workload off, solutions like ambient listening, how we apply, technology and AI to, physician and clinician in baskets to simplify that, how we message with patients differently. I think these are all technologies that will help us in the future. Look, we're in the early phases of this, but I think the potential is very large. And being at meetings like TiEcon, you get to talk to the people that are making this happen. Hearing Satya and Adela this morning and talking about relevance and the importance of creating new capabilities, that's what we're thinking about at Sutter Health. How we create new capabilities so we can tackle the problems of tomorrow.
I'm also thinking about the education being revamped all the way. Do you think a doctor's lifespan of studying can also decrease in the way the AI is coming up? It takes on an average about 10 to 14 years for them to actually become physicians and doctors in that sense. That should also decrease their time to actually come and become doctors and help those that in need.
Well, I think if you look at the amount of new discovery we have every day, and then the question is for a physician that's working day to day, how do they keep up to date on new discovery? And I think that's where AI and tools, will help us, to help our physicians stay up to date, have the, use those technologies to query, to get the latest, papers or the latest thinking or the latest studies on that. So I think it's about having technology and AI kind of walk alongside with our physicians and clinicians to help them increase their capability and to allow them to be able to stay current, because no human can absorb all the information we have today, and I think that's where technology can really help us in the future.
I appreciate that, and I think this is where, Anita, your credit goes to you, the fact that you've chosen some really relevant booths out there with people who are making the real meaning of AI come to life, and your thoughts around all these exhibition companies that are here, startup companies.
So I think it's very important that people come together to talk about some of these things and dissipate some of the fear that AI is going to replace the human person, right? You're not going to have I don't feel comfortable going to an AI doctor. I still want to go to my Sutter Health doctor. But it's very encouraging to know that at his or her fingertips, they will have access to all the right information to accelerate their decision making, not to replace the decision making. And I think that the companies that we see in the expo today in healthcare are all dealing with data and bridging that gap. But also, I think the big message which we've heard from Warner today is, hey, no 1,000 apps there. We need integrated apps. We need to work with innovators that are going to be working closely with us and developing the right solution that makes sense.
It's amazing. Thank you so much for talking to us, both of you. Thank you once again.
Thank you. Thank you. Thank you.